Hi, I'm Dr. Anthony Liperuote, and I'm here to talk about the fourth tip on how to prevent low back pain. During sleeping positions, people can irritate themselves pretty good by doing it in the wrong position. There are three main positions to sleep in. The first position my assistant Frank's going to show us is a face down position. And most people, as they lie face down, they tuck their arms under their pillow. Their head is fully rotated to the side. And what that does is it adds a lot of irritation to that mid-thoracic spine between the shoulder blades, to the neck, irritates the nerves that go up over their head. You can end up with that dead arm feeling because your arms have fallen asleep, your hands have fallen asleep, just because they're in an improper position. Not very supported. But what this does is it actually arches his back to create an arching effect as he's laying there. So he's not in a neutral position. He's kind of pushed up like that. And what that does is it puts a lot of pressure on that low back as well. So one of the ways you can prevent this is one of my female patients that has one of those hair clips that look like teeth. You open it up, you could put one right on the front of your nightshirt, and it's an inexpensive, easy way to create an irritation if you lay on your stomach, and it won't hurt you or anything, but it will wake you up enough to shift positions. The other position is your side position. Now, this is the first of the two positions that we really recommend. And side sleeping is all about, see how this normal pillow, his head ducks down a little bit. It's not equal with the rest of his spine here. His leg drops because people's knees are naturally narrower than their hips. And so it creates this slanting effect that puts a lot of pressure on his hip and his low back. So in this case, we have a special pillow that is built for side sleeping. That is a big block here, and what that tries to do is lift the head up to make up for the distance that's between the shoulder and his neck, and that keeps his head from flopping one way or the other. So to demonstrate it, we're going to put this underneath his head there, and you can see how his neck is now in line with the rest of his spine, and then that leads this to be fixed here. So what we do is we put a small pillow between his legs. Let's lift up your leg there. All the way down from his knee to his ankle. And what that does is that now lifts the leg and takes the pressure off of the low back, off of that hip structure, and then makes it neutral all the way through. So this is the first of the two proper sleeping positions. Then let's go ahead and lay on your back, please. And then again, this pillow is designed to create kind of a cradling effect in the head, so it holds your head in that proper position so your neck is in the proper curve that it's supposed to have, and it offers support all the way through the upper back spine or the thoracic spine. Now his body's really in neutral. Here, Frank, put your feet straight. But when we do this, this puts a lot of pressure on that low back, just having your legs straight like that. So we recommend, again, a pillow underneath your knees. And then pick up your knees there a little bit, like that. And even that little bit will take away the irritation or the stress that you're putting on that low back. And this is a proper sleeping position as well.